You're listening to the Dental Zone podcast. I'm Dr. Rachel Hall. This is the place that supports you to understand your dental issues, the causes and how to prevent them, empowering each individual to get the most out of life while bearing a stunning smile. Hello and welcome to the Dental Zone podcast. I'm Dr. Rachel Hall, holistic dentist from Brisbane, Australia. Thank you so much for joining me. I'm continuing in my series on how to improve your oral and overall health. I think this is part 4 or 5 of that series, and we're up to something like episode 55 of the Dental Zone now. So if you are interested in all things teeth, mouth and health, then you can hop on over to holisticdentistry.au and check out the information there. And you can hop on over to my dental practice website, which is evolvedental.com.au, or of course, listen to more episodes of the Dental Zone, or even check out my YouTube channel. So today I'm going to talk to you about the tips and tools of the trade, things that you can use at home to have better oral health, to help prevent tooth decay, gum disease, and mouth problems. And I'm sure you're sitting there thinking, oh no, not another dentist banging on about toothbrushing and flossing. Well, yes, there's going to be some of that, but I'm also going to talk about some other tools that you can apply and why you should be using them and how they're going to help you. So let's get into it. Let's get into the zone and look at the tools that you can use for your oral health care at home, your at-home hygiene regime. Now, I want you to become your own specialist in preventive dental hygiene. You need to have the knowledge, which I have been sharing with you, and you need to know what tools to use and why to use them. You need to know what's available, what to pick, and what's appropriate for you and your oral health and your mouth and your dental condition. So we've seen radical changes over the last few decades in the way we eat. We now have a lot more processed and refined foods, a lot softer diet, more sugars in our diet, more chemical-laden diet as well. And it's not as kind to our bodies as we'd like to think. You've only got to look at the current statistics for health, obesity, metabolic disease, type 2 diabetes. I don't even think that was a thing when I was a child. Yes, I'm in my early 50s, but I don't remember people having type 2 diabetes, not even as a teenager, not even in my 20s and 30s. It was very, very unheard of. And now it is super common, and yet it is preventable and it's treatable. And we are still having issues, and that's just one health condition. So this has not been a good thing for us. It has not been a good thing for us overall. And these dietary changes have not been a good thing for our dental health either. We can no longer prevent tooth and gum disease just by eating a natural diet because nobody's doing it. Well, very few are doing it. But it is one of the things that you can do. It's a massive preventive measure. But so your diet, and I've said this many, many times, your diet is the crucial factor in your dental health, as it's the most crucial factor in your overall health and for weight control, losing weight, maintaining weight. You've got to know what you're going to use, and you've got to be able to use it properly to be able to cure your dental disease and prevent yourself from having future disease. Well, there's some tools that are free. Well, that's a good thing because we're always concerned about money, particularly in these times where interest rates are through the roof and the cost of living is quite insane. So, time. We all say we don't have enough time. But if you can commit 5-10 minutes morning and night to looking after your mouth, that's going to be a great investment of your time. It's free. You don't need any maintenance. You just got to be willing to do it. You got your hands, they're also free. If you want to get rid of nasty gum disease, then you've got to put your hands to work. You've got to be patient with them. You're going to have to train them. You've got to make the mind-body connection. You've got to make the muscle memory. You've got to get your hand-eye coordination going, and you've got to get that brain-to-hand connection. And it is going to be awkward at first. You're going to get in a bit of a pickle, a bit of a knot. You're going to be, oh my gosh, you can't do it. It's all back to front. But just like anything else, like learning a musical instrument or a trade or a skill, you've just got to keep practicing, and over time it will just click. Your hands will get the hang of it, and you'll be performing preventative hygiene really quickly. Just commit to it. If you get a bit stuck, just stop, take a breath, restart, and have another go. I've already said it, but diet. The only completely natural way to clean your teeth is with your diet, because every other tool was invented was because we've done it, because we're not doing things naturally. We need an adjunct. We need something extra. So by diet, I mean disease-preventing foods, not disease-causing ones. So eat as many whole, unprocessed foods as possible, including grains, fresh veggies, a little bit of fruit, your proteins. And then by doing that, by having a good diet, by reducing and cutting down on sugar, you're not going to need so many of the mechanical tools, because you're not going to be having so much plaque and tartar buildup, and you're not going to be having so many problems with your gums, mouth, and teeth. So let's look at the traditional dental tools. There's your toothbrush. And I get asked all the time, Rachel, what's the best toothbrush to use? And I'm like, one that you like, one that you will use, and one that you'll be able to get into all the little nooks and crannies and corners of your mouth. There's several different types. They come in all shapes, colours and sizes, and the condition of your mouth is going to dictate which kind of brush is going to be best for you. The type of brush you use is really depending on where you're at. So in the initial stage of the treatment of your preventive program, you may not have the same brush that you're going to use later on for your maintenance stage. You may find that you need more than one kind of brush in order to take care of your mouth. And this is where your hygienist and your dentist are really going to come into the fore to be able to help you decide which are the best brushes. But if I'm going to be generic, then I want you to have a brush that gives you a, that has a small, compact head. Because the smaller brush is going to be able to get into all the places more easily, and you'll be able to get to those hard to reach areas. I want you to have a brush with soft bristles, because you're not going to do damage to your teeth. And I'm going to go into that in more detail now. And you can always skip forward if you don't like to hear about toothbrushes. But for those of you who do, let's go. So, the stiffness of the bristles. Most brushes come with hard, medium or soft. For most people who've got gum disease or periodontal disease, the general rule is use a soft bristle brush until the disease is eliminated, and then you can use a soft to medium one for maintenance. Personally, I don't recommend hard bristle brushes at all, particularly while you're treating periodontal disease. The hard brush is then just not flexible enough to bend into the gum gap, that little crevice or gutter around the tooth. And if you use it incorrectly and with too much force, they're going to do more harm than good, particularly to the tender, damaged gum tissue that is present when you've got gum disease. When your gums have healed, you can go to a more stiff brush, and I wouldn't go hard but go medium, because the gums can tolerate a little bit more pressure now. Now, hard bristle brushes, I can't say that today, hard bristle brushes are valuable when you've missed a few brushings and you need to give your teeth a bit of an extra scrub. But I would say you don't really need to do that, because you can use your normal brush with a little bit of baking soda to get the same results, and you're going to have less trauma to your teeth and gums. There's really no standard control of how stiff those bristle brushes are. So one brand might say these are medium, and that may be a hard bristle in another brand. So you've got to kind of check in with your hygienist, with your dentist, and see which is going to be the best one for you and your condition. Now, there are different kind of bristles that make up the brush. There's natural and synthetic. I'd suggest you try both and decide which one you like for yourself. Natural bristle toothbrushes are made in fewer sizes, shapes and stiffness. They're a bit difficult to find. Your local health food store might have them. You might be able to get them online. Because they're porous, those natural bristles need more time to dry out in order to retain their stiffness. If you do decide on a natural bristle toothbrush, have two of them. Have one that you use in the morning and then you let that dry out and use it the next morning, and one that you just use in the evening. That means you're giving them 24 hours to dry. Over time, though, those bristles will fray at the end. And, some dentists say that's an advantage because you've got more bristles. Others would say no. And look, if you're vegetarian or vegan or you don't do pork or pig, then those bristles are made from boar hair and they're not going to be right for you. Synthetic bristles are made from nylon. Yes, I know, landfill. They're easier to find. You have more variety. They have round ends on the bristles so that they're more gentle. They don't irritate your gums. I don't really think there's much in it. It's not really that important. Regardless of the type, a toothbrush will only do what you do with it at the end of the day. A toothbrush is only good as how you use it. And yes, you can use a manual toothbrush, you can use an electric one. I really like Philips Sonicare. They have a sonic wave vibration that goes through with the movement, and that sonic pulse actually helps destroy bacteria above and below the gum line. So I have to say that's probably one of my most favourite toothbrushes. No, I don't have any affiliates with them. I don't get any kickback for recommending them. I just like it as a toothbrush. The size. Choose the best size for your mouth. If you've got a small, narrow mouth, you want a small, narrow brush. The smaller the brush head, the easier you can get into the back there for you. You can judge your mouth size by your body size. If you're a little person, you're going to have a little mouth. If you're a large person, you're going to have a large mouth. Quite simple. The right size toothbrush is going to give you better control and better access, and it therefore is going to do a much better jobs. You want the size of the head around no more than about 2 centimeters. I think that's probably still a little bit big. You don't have to bring in a tape measure. Just use your thumb. Have a little look. You might be tempted to buy a longer brush thinking, I can get more teeth in less time. But the longer brush doesn't get into all the little bits and doesn't get into the curves and grooves very well. And it makes it almost impossibly to brush the insides of your front teeth properly because it just doesn't fit. You just have to be willing to experiment. And if you find a brush that you really like, I would say buy quite a few in one go, because what happens? Yep, you find a brush you like, you go back to the store to get some more, and they've discontinued it, or they're not stocking them anymore, and then you can't find them. Be sure to let the results of the brushing be your final guide, because that's going to tell you whether that's the right brush for you. If your dentist or your hygienist is keep telling you that there's areas you're not reaching, then you might have to change your brush sizes or get an additional different brush for those problem areas. Now, if we recommend that you change to another type of toothbrush or that you add any dental tool, please take our advice, because we're not doing it to sell you product. I make zero income from selling products. I sell them for the cost that I buy them for, maybe a 10 or 20 cents markup, not much, just to round up the numbers for doing the maths. But there are so many different tools that you can use these days. Now, the overall length of your toothbrush from the handle to the head should fit nicely in your hand with a little bit left over so you can reach in. Then you've got different shaped handles. Again, it's just choosing something that feels comfortable, that you can hold well. Your brush should have between, 7 and 13 rows of bristles and about 4 rows across. Now, find a brush. It's important to have a good number of rows because that can give you the flexibility to access into that gum crevice, that gingival gap, without having to force too many bristles into it. So, nice small brush, one that fits your mouth well, one that you like to hold. Now, there's different shapes. There's your straight, average, old-fashioned brush, and that's just fine. You can get different angled brushes, you can get curved brushes, and again, it depends what you like and what you need. But the standard shape brush is the most universal, and it's going to work as long as you get it in the right place. Then there's specially shaped toothbrushes that you might need if you've got missing teeth, rotated teeth, if you've got bridge work or dentures, if you've got orthodontic braces, if you have severe gum disease with bone loss and you've got some gaps and recession. There are almost as many weird and oddball shaped brushes as there are special dental problems requiring them. One of my favourites are interproximal brushes. They're for cleaning in between your teeth. They are fantastic. I think they're better than floss. And they are quite easy to use once you get the hang of it. And you can clean in between the spaces created by bone loss, between teeth around bridges and implants. And when you've got periodontal disease, and teeth have been lost, a standard toothbrush alone is not going to be enough. And again, make sure you get a recommendation from your dentist or hygienist. If you have a special dental problem, then just ask how you do it. I mean, you're going to use an interproximal brush, there's a gingival crevice brush, there's an orthodontics brush, there's brushes with longer and shorter bristles. If you can't find them in the stores, then ask at your dental practice and we can order them in for you. Well, how many toothbrushes are you going to need? Well, that depends on your condition and the condition of your gums. If your gums are healthy and you don't have any bone loss, you could get by with maybe, say, 3 brushes. Your regular brush that you use every day, a harder or more medium brush for those special scrubbing times, and then a little brush to clean in between your teeth. And if you have periodontal disease, you want to brush with, some special little brushes that your hygienist recommends. There's advantages to having at least 2 regular toothbrushes. You've always got one on hand and you've always got one that is dry. You want to have a dry brush because you get the stiffness of the bristles. I know we all wash them under the tap first, don't we? And we make them soft. I also like to have one at work. Yes, I'm a dentist, but even if I wasn't, I like to have one at work. And sometimes I will carry one in my bag as well. If I know I'm going out for lunch, I like to give my teeth a brush. So keeping your brush clean is really important because it becomes a very good bacterial incubator. The food particles and the moisture that become trapped at the bottom of the bristles provides everything that bacteria need to reproduce and grow rapidly, right on your very own brush that you're trying to use to keep your mouth clean. And research has shown that a dirty brush can contribute to dental disease by introducing bacteria from your brush back into your mouth. This hampers your hygiene program and it can contribute to colds and sore throats. Studies have shown that toothbrushes may contain more bacteria if they've sat for a time than immediately after you brush. So over time, those bacteria are breeding. So having an unclean or dirty brush is going to go against what you're trying to accomplish with your oral hygiene. And that is to reduce the number of nasty bacteria and bacteria in your mouth. This means you should sanitize your brush after each brushing. You can't completely sterilize it, but you want to reduce the amount of bacteria and the conditions in which they can breed. Never share your brush with anyone else because you don't want their bacteria and they don't want yours. Of the 2 types of bristles, the natural fiber ones tend to breed more germs because they're porous and they attract and hold more water. So how are you going to keep your brush clean? Well, rinse your brush thoroughly with hot water after each use, even when you use it without toothpaste. Let it drain by standing it on its handle in a glass or placing it in a toothbrush holder. Never let it lie flat with the bristles pointing to the sky. Alternate brushes so they've got a chance to dry out completely. Germs hate it when the brushes are dry because they die when their environment is not moist enough. Then you can use a hard bristle brush to clean your regular toothbrush every week or as needed. Just do this like you're cleaning a hairbrush. While running your toothbrush under water as hot as you can stand it, scrub it thoroughly with the hard bristle brush, and once you've cleaned it, rinse it in hot water and hang it to dry out. Change your brushes often. We recommend changing your brush about every 2 to 3 months, but if you've got advanced periodontal disease, you should change your brush more often, maybe every 2 weeks when you're starting on your hygiene program, and then monthly. If you've had a flu or a cold or a sore throat, you should probably change your toothbrush once the disease has subsided. You can use a sanitizing agent. You can use like an ultraviolet light or a product to reduce the germ count. I like to dip mine in an antibacterial mouthwash and then flick it all off so that it's not sopping wet, and then let my toothbrush dry out. So how long will your toothbrush last? Well, it depends how you use it. It depends on how hard or soft the bristles are. A soft brush will wear quicker than a hard one. Average toothbrush will wear out in 3 to 6 months. If it lasts you all year, you're probably using one that's completely worn out and you should buy a new one, or you're not using your toothbrush enough. If it's still in good shape, you aren't using it enough, to be honest. All the bristles are too hard. Replace your toothbrush when it's starting to look a little bit tatty, when it gets gunked up, when the bristles start to flatten, then it's time to replace it no matter how long you've been using it. It's also good to change to a new brush after you've had a hygiene visit at the dentist, because your mouth is nice and fresh, and you don't want to put the bacteria that were on your old brush back into your mouth after you've had a good cleaning. So I've spoken briefly about electric toothbrushes. I think they are a valuable addition and they are great technology. And again, they come in different sizes, shapes, colours, and different price points. But the thing they all have in common is that they can rotate the bristles faster than any human hand can move them. I call them the lazy person's toothbrush, but I'm not being facetious there. You can get a better cleaning with an electric toothbrush, but you have to still control them. You have to still make them work for you. You've still got to put them in the right places. They're only going to clean as good as you can maneuver them around. So whether they go up 4,000 times a minute or 1,000, whether they go up, down, backwards, forwards, counter, clockwise, anti-clockwise, clockwise, it doesn't really matter. You have to use them. You've got to let them get to all the places. You've got to angle them. And you've got to take your time with them, just like you have to do with a manual toothbrush. I find electric toothbrushes are great for people who don't have great manual dexterity, have poor grip strength, maybe have arthritis. Then they work really, really well. And then toothpaste. Oh my gosh, this podcast is going to go on for a month if we go into all this in great detail. It's going to be quite a long visit as podcast as it is, and I may split this into part 1 and part 2, I think. There seems to be as many brands of toothpaste as there are cars. There's paste, there's powders, there's gels, there's whiteners, brighteners, there's fluoride free, there's flavoured ones with baking soda, one with sensitive teeth. Well, what do? Well, you got to make your own choice. Again, everyone asks me, what do you think's the best toothpaste, Dr. Rachel? And I go, one you like the taste of and one you're going to use. You don't have to use toothpaste, but it does help to clean the teeth. It does help to put remineralizers in there. Again, it comes down to personal preference. It was originally invented to clean the clean your teeth of food debris and unsightly stains. When it was first marketed, very little was known about the cause of dental disease, but people did know enough to realise that if their teeth looked clean, they were actually more appealing than having a mouthful of dirty teeth. The first toothpastes were either too abrasive, too acidic, toxic, didn't taste nice, didn't feel nice, or they were all of the above. And now the toothpaste market is grown into a multi-billion-dollar-a-year industry. It has everything. I don't believe you as consumers are protected as much as you should be, because these are not considered pharmacological products or medicinal. They are considered just like your shampoo or soap, and they can basically put what they want in it and make any claims they like. But I don't recommend you ever swallow your toothpaste, even if you know what it contains. Rinse it out, spit it out. You do not need to be swallowing that toothpastey stuff. They're either going to be a therapeutic toothpaste or a cosmetic one. Your therapeutic ones are the ones I like best, because they actually have ingredients that have been shown to prevent or significantly reduce tooth decay and gum disease. You've got these ones now that promote that they're going to make your teeth whiter and brighter, but these products don't actually contain a lot of whitening product. They're actually quite acidic and abrasive, and they're going to damage your tooth enamel. And that's going to put you more at risk of tooth disease. So the ingredients, they're going to have different proportions. They are often a closely guarded secret, but they're going to contain some of these agents. An abrading, polishing agent. They will be about 50% of your toothpaste. It actually grinds off enamel and dentine, much like rough sandpaper scrapes away at wood. The polishing agents are included to help smooth off the roughened areas, like using fine sandpapers. And so they're going to be, you can be scrubbing your teeth away. You've got to be really careful. And you're going to end up with abrasion if you've got a high abrasive index in your toothpaste. It's acidic, depends on the hardness of your enamel, the hardness of your toothbrush, the force that you use, and how long and often you use your brush. You could use an abrasive toothpaste but not brush very hard or often, and therefore you're not going to wear away as much tooth. So just be really careful with this. There's a lot of these baking soda toothpaste, and they can be very, very abrasive if they're not used correctly. Then you've got these highly acidic ones, and they will definitely wear your teeth away. They were originally intended to remove like stains from coffee, tea, and smoking, and they're powerful enough to remove your enamel and dentine, especially true if you have softer teeth. Enamel is pretty hard. It looks solid white, but it's actually translucent, and it's the dentine underneath that is giving the enamel its yellow colour. So if you wear away your enamel, your teeth are going to end up looking yellower and yellower. And you're going to appear to be getting yellow teeth when you're actually scrubbing your enamel away. Many people are born with yellow-looking teeth. That's the colour. It's like colour of your skin or your hair. Don't fall into the whitener toothpaste trap. When you first use it, they're going to look really white, but then over time, you're actually going to destroy them. So there are different ways you can whiten your teeth. Have a chat with your dentist. Have a chat with your hygienist. See what toothpaste they're going to recommend for you. We don't want you to wear your tooth away because it does not grow back. There's this thing called an abrasive index, and it's a measuring system by which we can work out what's going to be too abrasive. Baking soda on its own is a powerful abrasive. Now, there are some baking soda brands where the particles have been made to be less abrasive, and they're worth looking out for. And even salt, some people like to brush with sea salt. That is also abrasive. So you're going to see things like zirconium silicate. Now, that's very abrasive, as is pumice. Calcium carbonate, that's in toothpaste. That's quite abrasive. calcium pyrophosphate, a little bit less, and then dicalcium phosphate, that's probably one of the lowest abrasion factors in your toothpaste. So again, just be aware of what you're using. A lot of them are going to have binders. That's going to form the gel and keep the thing together. So some of these are like, you'll see it called gum. There's also things like alginates. They're made from seaweed. Then there's carrageenan, xanthan and cellulose, and they're all okay. You can feel pretty good about those because they're all plant derived. Then you've got anti-drying agents, which are called humectants. They keep the gel liquidy, stops it going hard, and then they'll commonly use like sorbitol, glycerol, or propylene glycol, and they'll make up about 25% of your toothpaste. Then you get detergents and foaming agents. Yes, many toothpastes contain soap. A lot of them, I don't know whether they still do, but some do contain triclosan, which is soap, and it has been shown to have some negative effects on health and well-being, so you want to avoid that. But yep, you're putting soap, and one of them is sodium lauryl sulfate. That can cause a lot of allergies, so you may want to avoid the SLS. They do have some antibacterial actions, but again, you don't need a detergent in your toothpaste. Then you've got flavouring agents, so these can be like essential oils, like your mint. You don't need to have flavour for it to do its job. You can use things like clove, anise and cinnamon. There's things like coconut, apple now, so many different flavours. I have one that's fennel. That's really quite nice. Again, it's just, what do you like the taste of? A lot of people don't like mint, find it too hot, so look for something different. Most toothpastes add a sweetener. Luckily, no one adds sugar. They're all kind of like your artificial sweeteners, and again, you might want to avoid those because, what's that doing? Then a lot of them have colouring agents. Do we really need red, green and blue toothpaste? No. Again, something to avoid. You just don't need it. And then they have water in them, and that makes up about 25%. Then they've got preservatives. They use sodium benzoate. It's in many foods. Just check the labels. If you want to go for something that's natural, then use a natural toothpaste. That's what I do. You don't want to be ingesting a lot of chemicals. Your mouth's highly absorbent as well. Things will go directly from your mouth into your bloodstream without you even swallowing it. And then what are those things doing to your microbiome? Some preservatives that were used in the past are like formaldehyde, parabens, and oh my gosh. Then you've got anti-plaque agents. So you've got fluoride and other chemicals because of their ability to kill and inhibit germs. I'm going to tell you I'm going to be fluoride free. If you're unable to keep your gums and healthy using a non-fluoridated toothpaste, then you may want to just use a topical one for a short time. Again, I'm not so against topical fluoride. It's ingesting the stuff, but I do try and prefer to avoid it where possible. So I recommend you use natural toothpaste. They've got no artificial ingredients. You're going to assimilate some of the compounds found in your toothpaste whether you absorb it through the tissues of your mouth or actually swallow them. So therefore, I'd rather ingest natural substances, not your artificial ones. And if you've got kids, then you really want to give them the best start. So there's lots of natural toothpaste out there. Look for one that tastes good and feels good in your mouth. A lot of the natural ones can be a little bit yucky, but thankfully now we've got some really good ranges. There's Kingfisher in the UK. There's Gem here in Australia, and Grant's. I think it's Dr. Tom's or Tom's in the US. But there's many natural toothpastes out there that you can have a try. On its own, if you just put toothpaste on your teeth and just put it there, it's never going to prevent dental disease on its own. you actually need to brush it around your mouth, and it's the brushing action that's going to get rid of the plaque buildup from your teeth. Most toothpaste now are, the tubes are lined with inert substances so that the chemicals in the paste don't react with the lining. Some are lined with aluminium. Try and avoid that where you can. Buy toothpaste that don't come in plastic containers if you can. There's a lot now in biodegradable. You can get them in glass. You can get like it in a pot. You can get toothpaste tablets as well. I don't particularly like those, but that's me. But again, we're just looking at being, mindful of taking care of our health and the environment. Then some people can be sensitive to some of the ingredients in the toothpaste. They can get reactions from mild irritation to burning and inflammation of the mucous membranes, so like the lining of your mouth, even ulceration, even ulcerations. So most common irritants that are found are the detergents, the sodium lauryl sulfate, and sometimes the essential oils like clove or peppermint. So pay attention to the sensations when you're brushing in your mouth and after. If you notice any symptoms, try brushing a few days without the toothpaste, and if they disappear, then you're probably sensitive to that toothpaste. If you have a sensitive mouth or you're susceptible to cold sores, then irritants found in toothpaste could make your conditions worse and be a contributing factor. If you think that that's happening, then go for a blander toothpaste. Make sure it's got no detergents and no essential oils. If the irritation persists, then change brands and maybe get some advice. There are tooth powders as well. They can be still around. As I said, the toothpaste tablets. Now we've got toothpaste that are going to be formulated to treat things like sensitive teeth, for teeth that are sensitive for, things like hot and cold, acidic foods, or sweet things. When the teeth are sensitive like that, it's that some of the nerve endings are being exposed to the outside environment, and unless you're aware of the specific cause of your sensitivity, you're going to probably be wasting your money buying toothpaste that are supposed to reduce it. Some teeth can be sensitive because they've had a new filling, they've got decay, they've got fractures or cracks, they've got exposed root surfaces, and none of the toothpaste will alleviate all these problems. I mean, sensitivity by a new filling may just take time, but if you've got decay or a fracture, that's going to need dental treatment. But there is a place for sensitive type toothpaste. They treat the root sensitivity caused by abrasion and gum recession where you've got exposed root surfaces. You've got to be very, very gentle with this. Those microscopic tubules that you can see that make up the dentine that run from the surface into the middle of the tooth, they contain fluid, and that connects the outside of your tooth to the inside where the pulp and the nerve is. They don't actually contain any nerve endings, but what they do is they help transmit the external irritant to the nerve. So if your abrasion continues, the mineral deposited by your saliva and any secondary dentine that forms, that's a self-defense mechanism, that gets into the outer tubes and it would normally seal things over. But if you keep abrading it, then it's not going to seal up and you'll continue with sensitivity. So you may just need to swap to a softer brush and a softer technique, and then your sensitivity would go away. As long as you work with your dentist and your hygienist, then I'm happy for you to use a sensitive toothpaste. You can actually also use it a little bit like an ointment, where you rub it onto those areas before you go to bed at night, and just a small amount, like putting a little dab on there to help it remineralize. Baking soda is really good for scouring pots and pans. It's really good for cleaning your toilets and sinks as well when you mix it with white vinegar. I know that because I live on acreage and we have a septic tank system, and you can't pour bleach and cleaning products down into that because it ruins your septic tank. But baking soda and white vinegar, great for cleaning your porcelain, maybe not so good for your mouth. But baking soda on its own has a really good place in your oral hygiene regime. It's a valuable cleansing aid, can be used when you've been unable to brush your teeth for a day or more, and used as a once a week only tooth scrub. Some toothpastes have baking soda in them, but they are too abrasive. If you use it, however, just for your super scrub straight, I don't mind, but it is highly abrasive, so don't do it too often. Baking soda contains sodium, and that can be absorbed through your mouth tissues, and just be aware, you don't want to be increasing your sodium in your diet if you're on a low sodium diet. But baking soda neutralizes acid producing bacteria. Now, the way I like to use it is you mix a quarter of a teaspoon of baking soda with a quarter of a teaspoon of 3% hydrogen peroxide into some water, and you mix that all up, and you dip your brush in it after you've brushed your teeth and cleaned your brush off, and then you brush that watery baking soda peroxide mix around your mouth and gums to help neutralize bacteria and act as an antibacterial. So you can then use that as a mouth rinse. It will neutralize the acids and freshen your breath, but rinse and gargle well afterwards to reduce the amount of sodium. Salt, my grandpa used to use salt for his toothpaste. It's very good if you've got a mouth ulcer to use hot salty water to wash around with, but I would only use salt once your gums have healed from the disease, and only use it occasionally. So again, just watch out for the sodium. Like I said, you can always use hydrogen peroxide or other antibacterial agents instead, because they're not going to be harmful. Both baking soda, bicarbonate, and hydrogen peroxide are natural. Hydrogen peroxide, your cells produce that anyway. You're just supporting your body's own defenses, but again, nothing too abrasive on the teeth. Dental floss, let's move on to dental floss. If the toothbrush is the king, then the floss is the queen. As I said earlier, and you may have heard me say this in other podcasts or on my videos or in my blogs, I am now a bigger fan of interdental brushes for gum health than I am for floss. Floss is great for pushing between the contact points of your teeth where they sit against each other. That helps remove the plaque that your interdental brush and your toothbrush won't get to. But I think you have to be a really amazing flosser to improve your gum health. And if you're not great at flossing, you can sometimes do more harm than good. But I do like floss. I think it is an important thing to do. It cleans in between the teeth. It will get underneath dental appliances, and it can prevent plaque from forming in the areas. It can remove food wedged between the teeth where a toothbrush can't budge it. And don't ever think you can avoid a visit to the hygienist by using floss on tartar. Floss will never remove tartar or calculus, neither will your toothbrush. However, it is a good preventive tool. So there's waxed and unwaxed. You can get ones that are coated with silicone. They can be impregnated with baking soda, essential oil, or fluoride. Again, different thicknesses. There's regular, tape, fine, shred resistant. Some are flavored. Your choice of floss is going to be personal, practical, functional, and ethical. There's so many brands. It's going to be a trial and error process. Sometimes you're better off asking us what we think. Again, we can't do a one size fits all. Well, let's have a look at the different types of flosses, and let me give you some ideas around those to help you make your decisions. Wax versus unwaxed. Now, I think waxed is easier to use. It slides in. It doesn't fray as easily. And because it doesn't fray, it works better in areas where you have fillings. I just think that it's more about the actual movement of the floss than what's on it. Have a go. See what you like. Now, there's your regular floss. This is the most common. It's thinner than tape. It's easier to use. It'll do the job for you. Again, some brands are thinner, and that's going to slide easier through your teeth if you've got tight together teeth and tight contacts. Tape is wider, and it's usually thicker. It's more effective when you've had bone loss and gum recession, and it's really, really good for where you've got root surfaces that need to be cleaned and polished. You can use the ones with the little floss holders. I think they're called flossettes. They're okay. They're good for just going up and down the teeth. They don't give you as much control. But if you can't master floss, then this is better than no floss at all. And again, it's all trial and error. But there is a tendency with these to slam the floss down into the gum between the teeth, and that can cause injury to the gum tissue. Because when you're doing it with your fingers, you can kind of seesaw it in, and you can get the action and you can encourage it in. So again, it's going to be a case of trying it. I know it's frustrating. You end up buying loads of packets of floss and you've got them all sitting under your sink in your bathroom because you can't just buy a small sample. This is where being at the dentist is helpful because we might be able to say, well, we've got these different ones. Here's some to try. Mouthwash. Now, mouthwash is not just there to fight bad breath. They are very effective in the treatment of gingivitis. There are many, many brands out there with different formulas, colours and tastes. They all have one thing in common. They reduce the number of germs found in your mouth. And again, it's only going to be as effective on how you use it. Rinsing with mouthwash will produce good results. It's going to reduce bleeding, it's going to reduce gingivitis and reduce plaque formation. You've got to use it twice a day after you've brushed and flossed. And you can use it with a water irrigation device. It's more effective because it delivers the mouthwash into the gingival crevice or pocket, so you get those germ-fighting ingredients where you need them. You can use it at full strength, but you can do equal parts water and equal parts mouthwash, and that's more effective. It's going to be less expensive. It's going to make your mouthwash go a bit further. You can rinse with your mouthwash after brushing and flossing, but it's about half as effective as it would be if you were using a water irrigation. Use your mouthwash at full strength if you're rinsing, and be sure to forcefully suck the solution backwards and forwards between the teeth. It's no good just kind of go and just, fizzing it round your mouth. You've got to give it a bit of force. You've got to actually be swooshing it quite hard so you're sucking it in between your teeth. You should include a mouthwash in your hygiene program. You should be doing that quite regularly while your gums are healing. But you should actually be able to keep them healthy without mouthwash. But whether you want to continue to use it or not, it is up to you. If you do, then use it after your final brushing of the day and following the ingestion of anything that contains sugar if you're unable to get to your toothbrush. You've got prescription ones. These contain chlorhexidine. This is very effective at reducing plaque and treating gingivitis, but everything comes with side effects. One of the things with chlorhexidine is it can actually stain your tooth, and if in prolonged use it can cause gum irritation. Not going to be recommending it for pregnant or nursing mothers. You've also got to watch out that mouthwashes don't contain alcohol because that's going to damage your mouth and gums. Prescription mouthwash is there to treat gingivitis, reduce plaque, but I would try an over-the-counter mouthwash first. Remember, without the willingness to brush, floss and use your oral waterpik, mouthwash alone is going to do nothing. That's like trying to put out a big bushfire with a water pistol. Your over-the-counter mouthwashes again, they're going to make all sorts of claims. They're going to have some with fluoride, some without, some that say they reduce tartar buildup. Again, you just want to be reducing the amount of germs that are in your mouth and using something that's not going to be harmful. So try and find a natural one. Now, at the dentist, we make you do a mouth rinse before we treat you to reduce the amount of the bacteria in the saliva and that's going up in our aerosols. If that's not a standard policy in your dentist's office, you should ask them to do this because you want to do a rinse before and after treatment. So we use a rinse that is essential oils, hydrogen peroxide, a little bit of menthol because just to even out the flavours. You get you to rinse that for half a minute before we start treatment, and then we put a splash of that in your water at the end of treatment for when you're rinsing out as well. Okay, so where are we to? So we've done toothbrushes, we've done the bristles, we've done floss, we've done mouthwash. So you want to look at what other things you can do. Well, there's chewing gum. So yes, it is a dental tool. So you can use a sugar-free gum after you've eaten your meal, and you can chew on that, and it will help to reduce the acid level in your mouth. And it will promote the flow of saliva, and it can neutralize the acid produced by the bacteria. It can freshen your breath. Now, if you use one with xylitol, xylitol has been shown to stop bacteria being able to stick together and cause biofilm quite so easily. So if you've had a meal, you've had something sugary, you're not able to brush your teeth, then rinse vigorously with water and then chew your gum for about 15 to 20 minutes. My partner hates chewing gum, so don't let them listen to this. Do not chew gum that contains sugar. I also don't advise you have chewing gum if you've got mercury amalgam fillings, because all that chewing is just going to stimulate more mercury removal. So you can get xylitol mints, and you can suck on those if you need to do something different. But if you chew gum, it's going to exercise your jaw muscles, and it's going to help stimulate blood and nutrient supply to the teeth and the jawbone and the gums. But if you've got TMJ problems or amalgam fillings, then I'm not recommending chewing gum for you because it can increase your problems. Then you've got water irrigation devices. So this is something that you use to irrigate in between your teeth down into the gums. It's really valuable at treating gum disease and also preventing it. So you don't have to wait until you've got gum problems to start using it. It's a great invention. I use one regularly. It can be a bit messy at first until you learn how to use it. What it does is it shoots a pulsating stream of water out of a nozzle, and the most effective devices that have are the ones that have controls that let you regulate the amount of pressure. When used the right way, in the right time, and directed in the right areas, then they help remove food debris and bacteria. It dislodges newly forming plaque, massages the gums, and delivers antibacterial agents to where your other things can't reach. They'll never replace your brush and floss, but they're to be used alongside of them. Most are electrically powered. You can hook, some will have a water container, some you can attach directly to the tap. You can use hot or cold water. It's up to you what you want. I don't like my water too cold, particularly in the winter. You can use the top brand is Waterpik. And that is a really good brand. They make a really wide selection and a smaller version for traveling as well. And they've got a tip that reaches further into the gum pockets. Toothpicks, I'm not a fan of toothpicks, particularly the wooden ones. You can use plastic ones. They're okay. The rubber ones I really like because they're flexible. They don't have any hard or sharp points, and they're less likely to harm the gum tissues, and then you've got the interdental brushes, which work in the same way. And again, I'm a really big fan of those. So you want something softer in between the teeth. You want something that's going to be very gentle, and you can get a little holder that you can put those interdental brushes into, or interdental picks, and that makes it easier for them to control. Then there's disclosing agents. Now, what these do is they're coloured tablets or liquid that contain a vegetable dye. And when the dye goes onto your teeth, it stains food debris and plaque, either like a red or pink or purplish colour, but it won't stain the teeth. That colour that doesn't wear off immediately, so you probably don't want to use it just before you go out on a date. It can also stain your clothes, and you should not swallow it. So what you do is you brush your teeth, you floss, then you use the disclosing agent that you get from the chemist or from your dentist, swoosh that around your mouth, gentle little rinse and spit out, and anywhere you've got stain, you have missed, and you've got plaque, tartar or biofilm, and you need to go over and clean that again. So you've got all the prevention tools now. I've gone through those. Then we've got to teach you how to use them, when to use them, and where to use them. It's your choice what you're going to use to keep your teeth, or whether you're going to risk losing them, or you're going to risk having disease that's going to impact on the rest of your body. You've got to make the tools work for you. If you don't use them, then nothing's going to help. And then I'm going to talk to you in the next episode about how to put these tools to work, how you do your personal home care program. I'm going to talk about when to brush, how to brush, and where you get that brush, and give you the real advice that you need. Because, come on, so many of you brush and you floss, and yet you still getting plaque and tartar build up. And we can say to you at the dental office, hey, you need to pay more attention here, you need to spend more time in this area. But if you don't know how to properly use your tools, none of that advice is going to make any difference. So I'm going to go through that in the next episode for you. So today we've looked at the tools of the trade for your oral hygiene care. I hope it hasn't been too dry. I know it seems pretty basic, but yet I find so many of my patients are confused by the whole oral hygiene thing. It's too many toothbrushes to choose from, too many different types of floss, too many different types of toothpaste and mouthwashes, too much conflicting information, and you're finding it hard to know what to do for the best. So hopefully this podcast, this episode of the Dental Zone, has really helped you with this. If you want to know more about how you can have a healthy mouth for a healthy life, then go on over to evolvedental.com.au. If you want to know more about holistic dentistry, you can also check out holisticdentistry.au, listen to other episodes of the Dental Zone, check us out on YouTube. If you'd like to see me for your oral hygiene care, for your dental treatment, for all your dental needs, then give my practice a call, 0737 20 1811, and me and my team will be really happy to take care of you. For now, go and get your toothbrush. Make sure you keep it dry, have two on the go, put into place some of these things. Go get yourself a good toothpaste, mouth rinse, go check out a waterpik, and really get yourself armed up to have the best oral hygiene. And next week's episode, we'll go through how to use things. Thank you so much for joining me. I'm Dr. Rachel Hall, holistic dentist. Until next time, stay in the zone. You've been listening to the Dental Zone podcast with Dr. Rachel Hall. For health, lifestyle, fitness, and a great smile, get in the zone.